What happens behind the scenes after you leave the doctor's office? The hidden side of Medicare claims, billing, EOBs, authorizations, and appeals. Welcome to Medicare 360. I'm your host, Jennifer Alfonso Lee, and today we're pulling back the curtain on something every Medicare beneficiary experiences, but very few truly understand. You go to the doctor, you check in, you see the physician, you go home, and then a few weeks later, you receive an explanation of benefits. A Medicare Summary Notice arrives, a bill appears, a prior authorization is requested, or perhaps a claim gets denied. And suddenly, you're asking, what happened after I left the doctor's office? So today's show is called What Happens Behind the Scenes After You Leave the Doctor's Office. We're going to walk through claims processing, Medicare billing, medical coding, explanation of benefits, Medicare summary notices, prior authorizations, appeals, denials, fraud prevention, real life Medicare case studies, because understanding the system makes you a much better healthcare consumer. So let's go over step one. The doctor visit ends. Most patients think the appointment ends when they leave. In reality, the paperwork process is just beginning. So after your appointment, your provider's office begins documenting why you were seen, what conditions were discussed, what procedures were performed, what diagnosis apply, what treatment was recommended. And why this documentation matters. Medicare doesn't apply simply pay because you visited a doctor. Medicare pays based on your medical necessity, documentation, diagnosis coding, and procedure coding. So every detail matters. So let's talk about a real life example. A patient just had a checkup. The claim may contain like diagnosis codes, procedure codes, preventive service codes, chronic condition documentation, all of which determine reimbursement. So, like, take for example, if you have a plan that is a chronic condition plan, and sometimes when the insurance company cannot verify that you have that chronic condition, be it like maybe surgeries or medication that they could pull, then they would have to get a note from your doctor's office, right? Or some type of form that basically states what your chronic condition is, just so you could keep the plan. So, like, what happens in that case is that they try to reach out to your doctor, and if that doesn't happen and the doctor doesn't respond, then they usually the insurance company usually contacts the agent like me, right, to help you with that, and then to help get you those forms. So once the doctor's office does get the forms, typically it really just depends on how the doctor's office will help out, meaning do they just fill out the form, get it over with because they know you have that chronic condition, or do they just do a long overall process which they do a write up? So like I've talked to different doctors offices, and every doctor's office is going to be different on that. So just something to clue. And like some people tell me like it's really good, it's fast, and some people tell me like, oh, we hate doing these. So just, you know, to kind of depends on the doctor's office and the doctor how they process these type of documentation. So if you do need help with that, we are kind of like that liaison between the doctor's office and you to help you push those through if needed, because typically those chronic condition plans have better better benefits, right? Because you have that chronic condition. So just keep that in mind. Okay. Let's talk about step number 2, which is medical coding. This is where many listeners are surprised. Healthcare providers don't submit claims in plain English. They use coding systems, right? So, diagnosis codes, every condition has a code. Examples like diabetes, hypertension, arthritis, heart disease. So these procedure codes, every service has a code. Like example, an office visit, a lab test, imaging, vaccinations. So why this matters, if coding is incorrect, claims may delay, deny, require corrections, right? So that's the biggest thing. Like sometimes when a client comes to me and be like, Jennifer, like they're not paying this bill, I have this large bill. Like first we kind of have to go in depth sometimes. We're like, okay, well, was it the right code they use? Because I'm sure AI has a lot to do and is more involved now, but I mean there's still error in that, AI or human error, right? So just keep cognizant of that. Sometimes it's not your fault, but it's just how it was coded, which is wrong. So let's go over a real life case study. A beneficiary received a bill from a preventive service. After the investigation, the issue wasn't the care, the issue was a coding. So once corrected, the claim was processed properly, right? So the teaching point is billing problems are not always coverage problems. Sometimes they're documentation problems. So that's the biggest thing. Another one was like, recently, like I'm an insurance agent and I know the coverages, right? And like how much you pay. Like my son, he had to go to a follow-up visit because he actually stayed overnight at the hospital for heat exhaustion. But in any case, he didn't have his annual physical, and this was a new doctor because we actually needed to find a doctor that was closer to where he went to college at UCLA. So I was thinking, hey, like, since he didn't have his annual physical, and annual physicals are at zero cost, why not just book the appointment for a physical, right? And then add on that, hey, he has these issues, right? But I asked, they said they tried to bill it as like the annual physical, but really it wasn't because he had to draw blood there. And so they did bill us like the copay, which is $60, which is just fine. So there you have it, right? But I've had it sometimes where like my kid has gone and like needs a referral somewhere, so we have to see the doctor. And if they didn't do their annual physical yet, I just say, hey, it's annual physical and this is what I need, right? So you don't pay that $60. So things like that, to just be a little bit more savvy and see if you could get things paid. Also, like there are indemnity plans if you do have a high deductible plan or plan that like costs a lot of co-pays or co-insurance. There are insurance indemnity plans where you pay a monthly premium. In an event that something like that service triggers, you could actually file a claim and get some money reimbursed. So it's pretty neat how those work. That's another topic for me because I was looking at the cost. I'm like, I'm just not going to do it. And then this year, my son goes to the ER, stays overnight, costs us an arm and a leg, right? But of course, at least he's safe and we have peace of mind. But things like that, I'm going off on a tangent. So let's go over step 3, which is claim submission. Now the provider sends the claim. The claim travels electronically. So what happens next? Medicare reviews it. Eligibility, coverage rules, medical necessity, coding accuracy. So questions Medicare asks: was the patient eligible? Was the service covered? Was the documentation sufficient? Were coding requirements met? Has the service already been billed? So, like the claim outcomes would generally be approved, claim gets paid. Partially approved, some services are covered, some are not. And then denied, further action is needed. Sometimes when it's denied, like people just let it go and pay for it. But you could always file an appeal, kind of get to the bottom of it, why it was denied. And so we could help you further in that to see if we could escalate this and file an appeal. And then sometimes there's pending additional information requests are needed. So that's like the process on there. Sometimes if you have a good medical group, very easy, things are processed very smoothly, but sometimes they are so slow. Okay, so explanation of benefits. This is one of the most misunderstood documents in healthcare. What is an EOB? So it's an explanation of benefits. It's not a bill. Okay, so let's repeat that. An EOB is not a bill. It explains what was billed, what was paid, what was adjusted, what may remain, not what remains, what may remain. So why people panic? Many beneficiaries received an EOB, explanation of benefit. They see 15,000 billed and assume I owe 15,000. So usually not. The bill amount and approved amount are often very different. So a real life case study: hospital charges 25,000, Medicare approved amount 8,000. Medicare pays its share, right? So patient responsibility, a much smaller amount. Yes, the patient panics after seeing their first number. So just another tangent on this, like my son, like the bills came, I looked it over, just made sure that it was correct. Everything looked on the go, on the up and up. And so like I got another bill and my husband was freaking out. He's all like, what was it? Maybe like 2 or 3, 4,000 for an ambulance. And we know in my city that we pay like a tax or surcharge for that on our utility bill. So we knew really the ambulance would only be, I think, 100 or 150. Luckily, just on a side note, my son had an ambulance come pick him up like on like the street. So we were like, oh, is that going to be covered? But I think I had read up that it was, if it's within the city, it will be covered. But in any case, my husband was freaking out. Then he started making me freak out, right? Not that we have to pay the bill, but just like the paperwork or calling to make sure. But then I looked at the, the bill, which wasn't the bill. It was the, the EOB, which is the explanation of benefits, right? So it does say there, it may be billed, right? Like it says deny, this is how much we'll cover. This may be your portion, right? So I was telling my husband, you don't need to worry about this because it's an explanation of benefit. What we need to worry about is when the particular ambulance, the vendor, the hospital, the medical provider bills us and says, you need to pay this, right? And then at that point, then I would just say, we live in the city of Anaheim. This should be covered, and let them know that way, right? So far, so good. I have not received a bill for that. If I do, I will, definitely do that appeal or just let them know. And sometimes it's just kind of like they don't know you have insurance, like a secondary insurance to pay for it, or they don't know if you had like Medicaid or Medi-Cal that could help pay for it, or like secondary. So just keep that in mind. So the teaching point is read the entire explanation of benefit before worrying, because it is confusing, right? You get like the bill from the insurance company. Then if you get the bill, well, not the bill, the explanation of benefits that people think, and it looks like a bill, right? And then you do get the actual. So just keep that in mind. Okay, so let us move on to the Medicare Summary Notice. Many confuse the EOB and the MSN. Okay. If confuse the explanation of benefits through the Medicare Summary Notice. They are not the same. Okay. So, what is a Medicare Summary Notice? The Medicare Summary Notice is a Medicare's official summary. It explains services received, provider charges, Medicare payments, potential patient responsibility. Why you should review it. Errors do happen, right? Fraud happens, duplicate billing happens. So, what to look for? Did you actually receive the service, right? Was the date correct? Was the provider correct? Does the charges make sense? Okay. I would say fraud is so rampant. I mean, there's just this one lady. I don't know what she was, an administrator or whatever it may be. I think it was $1 billion that was fraud. So it is crazy. One of the best fraud prevention tools is just simply reading your Medicare summary notices. The biggest thing on this, I would say, is that if you get billed for something or not billed, or the Medicare summary notices says like a doctor is billing you for $5,000 every single month, and you never met this doctor, and unfortunately, this did happen to my father-in-law. They lived with us, but hey, I never really looked at their like Medicare summary notices until like I started digging, and then figured out it was fraud. But a doctor was charging like 5,000 to Medicare for my father-in-law being in hospice, and he wasn't. No one ever visited him. It was just bad. But unfortunately, my in-laws did not want to like press charges or do anything. They just didn't know how it worked. So kind of left it at that. But it is so rampant. There's these rings that know exactly how to bill Medicare, and they use it to their advantage. They don't have patience. They do have patients. Their patients don't know what they're signing up for. It's just horrible. And I hope it gets just more cracked down, because, I mean, it's so much fraud, waste, abuse, and, tax dollars that we have to spend. But let's not, let's move on. Okay, so let's talk about prior authorizations. This is one of the most frustrating topics in healthcare, prior authorizations. So it is a prior authorization. Certain services require approval before they are performed. So examples may include advanced imaging, certain surgeries, specialty medications, durable medical equipment. Okay, so why does it exist? The goal is generally to determine medical necessity, appropriate treatment, and cost management. So why patients do get frustrated? Patients often think, my doctor ordered it, why isn't that enough? And then because another review process may still occur. And then with just that too, sometimes it falls through the cracks, and you want like a cane or a wheelchair or something. You ask your doctor and they never ordered it, never went through. So things like that I've seen very common. So let's talk about a real life case study. A beneficiary needs an MRI. The physician orders it. Approval takes additional review. The patient feels frustrated. So understanding the process helps reduce confusion in every little step, right? Did the physician order it? Was it actually sent, process received, right? And then if there was an additional review, did the doctor know about it, and did they follow up with it? So those are like the things that I see often. I've seen where like someone needs to go skilled nursing, and then they're saying that that it was denied by the insurance company. But then lo and behold, when we call the insurance company, they're like, we'd never even received that request, right? So how could they approve it and how could they deny it? So things like that definitely may happen. So just things like that to keep in mind. Okay. So let's talk about claims denials and appeals. Now, let's discuss denials. A denial does not always mean no forever. Sometimes it means more information is needed. So common reasons for denials: missing documentation, code issues, medical necessity questions, coverage limitations, administrative errors. So appeals, beneficiaries have appeal rights. This is extremely important. Medicare and medication was denied. Additional medical documentation was submitted. The appeal was approved. Coverage was granted. So don't assume a denial is the final answer. There's always appeals and processes in place. So that's what we do. We pride ourselves in helping our clients to make sure you're educated and your case, your problem, your situation doesn't fall through the cracks like many times that I've seen if you're not working with us. So let's go over Medicare fraud prevention, which I already touched over a little bit. Fraud costs billions annually. Beneficiaries play an important role in this. Watch for services never received, like I had mentioned with my father-in-law, equipment never ordered, duplicate charges, suspicious phone calls, requests for Medicare numbers. It's like your social security number. Do not give it. Okay. Protect your Medicare card. Treat it like a credit card. Don't provide information to unsolicited callers. Just hang up, I say. So a teaching point is most seniors are honest, most providers are honest, but vigilance does matter. So if you do remember one thing from today's show, let it be this: your healthcare journey doesn't end when you leave the doctor's office. Behind every appointment is an entire system: documentation, coding, claims processing, Medicare review, explanation of benefits, your EOBs, your summary of notices, your prior authorizations, your appeal. The more you understand the process, the more empowered you become. Just don't leave it to chance, right? Don't be that number. And with you, you are not that number. You don't need to become a billing expert, but understanding the basics can reduce stress, prevent mistakes, catch fraud, save money, improve healthcare outcomes. Okay. So thank you for joining me today on Medicare 360. I'm Jennifer Alfonso Lee, and next week we will conclude the series with 20 plus years of Medicare lessons, what I've learned helping thousands of seniors. So we'll discuss biggest mistakes, biggest surprises, most important advice, success stories, changes in Medicare over the years, because boy, there are always changes, right? Every single year. Insurance companies have to file their plans every single year. What future retirees should know. So until next time, stay informed, stay engaged, and remember, clarity always comes before coverage. You have a wonderful day. I'll see you next week.